This is Boomer Life on CL 650.
That's how you lose it all.
We are back on CL 650 with Boomer Life. Our guest today from Integrative Naturopathic Medical Center in Vancouver, naturopathic physician Dr. Katie Leah, along with Kirsten McEwen, a registered holistic nutritionist. Integrative Naturopathic Medical Center, a long-standing history as offering the leading edge and effective therapies in tune with the needs of today's baby boomers. And as you're going along, if there's maybe a point that you may have missed and you want to check on it, you can go to integrative.ca on the web. That'll help you out. Katie and Kirsten, let's talk about the weight management program at Integrative Naturopathic, your specific program. Walk me through it. Let's say if I walked in and I'm over 50, a little, what would you do? Tell me what the experience is going to be like.
So the initial visit is actually an hour long. So I spend quite a lot of time with clients who come in to do the weight management program. And really in that hour, we just get to know each other. So we talk about, what's working for somebody, what's not working for somebody, or what may or may not have worked in the past, what their current diet is like, what their current lifestyle is like, what their health issues may be, what their goals are, all of those things. So we really just get to know each other.
Trust is, I would imagine, would be a very important thing because people they may have been a little reticent to go in and admit that they've got a problem or they can't figure out what it was. Some people just used to plowing through an issue, but now they've got something that their body has changed, their life has changed, and they can't figure it out. So they have to trust you.
Absolutely. I mean, we're trying to build relationships with people, and from our perspective, being in prominently naturopathic clinic, we're really trying to get to know all of the details about a person, not just their health history, but also their genetic predispositions, their stress levels. We want to know about their family and the support that they have. So we're really trying to get this sort of holistic view of our patients and our clients. And I think that allows us to tailor a program, whether it's a weight management program or something else, a hormone balancing program, to really sort of fit them individually.
Let's talk a little bit right now then about hormone changes, and I assume that we're talking more so about women as they get a little older, that being a bigger problem for the patient?
Absolutely. A lot of, and this includes women and men, but we see probably more women than men in our practice at Integrative. But it's something that it's a natural transition. It happens with aging. It's something that unfortunately is unavoidable. The good news is there's a lot of things that we can do to help support people through hormonal transitions. And this is something that we have a lot of options available for testing and also for treatment at Integrative.
Okay, let's talk about some of those changes. As there's 1,000 jokes that have been made about the change of life, and not just for women, but what is it? My wife called it menopause. As we go through it, what are some of the things that, for example, that won't let you lose the inches off a waistline, which is no matter what you do, no matter how much you exercise or what you change or eat less, and sometimes you do yourself a lot of disfavors by doing that.
Absolutely. There's a lot of changes that happen for both men and women with their hormone levels, and these include hormones like estrogen and progesterone and testosterone for both men and women. And as these hormones naturally start to decline, there's a whole bunch of things that we see symptomatically. People's energy changes, they start to experience more fatigue, their cognitive function starts to change. So, sometimes it's memory issues, it's focus and concentration. Certainly we see a lot of people who start to gain weight, and sometimes it starts off at this very, very slow pace, but over maybe 5 or 10 years, all of a sudden they realize that they've gained 15, 20 pounds. We also see, a lot of things in terms of just sort of the stress levels that also affect our hormonal system, and talking about other hormones, adrenal and cortisol and thyroid hormones have this really important part to play in all of that as well.
When you talk about the thyroid, I've heard of people with an overactive thyroid or an underactive thyroid. Help me out there understanding what changes, what effects are happening, because I know that people have talked to me about, I had a thyroid problem, but it's fixed now and I'm better. But I don't understand it. So maybe you can explain it to people out there who may be feeling something but don't understand it. Maybe this is something they should be looking at.
Well, thyroid disorders are something that are very common. They affect both men and women. With weight in particular, it's usually an underactive thyroid that we're looking for. So, our thyroid is this very sort of small butterfly-shaped gland. It sits just underneath our Adam's apple, and its job is to predominantly regulate our metabolism, but it also is really important for things like regulating our body temperature, our energy levels, our absorption of some nutrients from the digestive system. So as our thyroid starts to slow down, and sometimes it's genetic predisposition, it does seem to follow the family members. We see things like low energy and fatigue, certainly low body temperature, weight gain, even mood changes. So depression and anxiety can also show up. Sometimes we also see things like hair and skin and nail changes. And generally people just, they feel like their metabolism has really sort of slowed down. And sometimes one of the biggest clues is, I've changed my diet, I'm eating really healthy, I'm exercising, I haven't done anything different, and I feel like I'm doing all of the right things, and I'm not seeing results. And those are the types of clues that we look at as, maybe there is a thyroid problem that we need to investigate.
What prompts people to come and see you? I mean, we've talked about some of the problems that people are going to encounter as they get a little bit older. We've talked a little bit about the thyroid. We've talked about the hormones in the body that change. But what usually drives somebody to say, I've got to get help, and then come to you?
I think it's when they're sick of the roller coaster.
Mm-hmm.
So they're sick of the up and down. They're sick of losing weight then gaining it back. They're sick of following some cookie cutter diet. So I think when people come to see us, they're looking for a sustainable long-term lifestyle shift and a personalized approach, which they haven't been able to get elsewhere. So yeah, they're just sick of being on the up and down.
And we've talked about the allopathic doctors, what we would call the standard traditional medical doctors, and how they're doing a better job of understanding the value of holistic medicine, of treating the mind and treating the body, and living a healthier lifestyle. How are people in general that you find coming in? Are they more accepting? Are people who are, say, my generation, they've been through it all, and maybe the medical doctor hasn't helped them in a particular way, and they go looking for answers? Are they much more accepting in what you can offer them now, and listening to what you have to say?
I think so. There's a spectrum of wellness, and on one end of that spectrum is disease and pathology, and those are cases where absolutely, your family doctor, specialists, they're a very, very important part of your care. On the other side of that spectrum is optimal wellness, and in terms of our approach, we certainly are always, we do a lot of disease management, and we do see a lot of people who need that acute care, but we're really trying to push people on the spectrum of wellness towards optimal. And so I think that's where naturopathic medicine, holistic nutrition are really valuable players. We're able to look at the bigger picture, and I think people are really looking for that. They want to feel well, and they want to age well, and they don't want to just sit and wait for something to go wrong. They really are active participants in their own healthcare now.
I'm sorry, go ahead.
One really interesting thing that I've noticed is that a lot of younger people who come to see me, oftentimes their parents will come to see me 6 months later when they see their son or their daughter feeling much better, they've lost weight, their hormones are more balanced, and then they think, what are they doing that's so interesting? And then we often see the parents come in later. Mm-hmm. So I think that's a really neat trend.
Yeah, we're seeing it cross generations now.
That would be very important. I would think to families that little things like the ability to communicate without judging, and how you're feeling about each other, that's got to play a role in feeling confident about trying something different, especially if the parents are liking what the kids are going through, because they always worry about the kids, and are they getting enough enough proper food, enough sleep, or are they and then they see the results with them. And of course, 60 being the new 40, they want to live a healthier lifestyle.
Absolutely.
All right. So we've talked about the combination of nutrition, lifestyle, and exercise in a platform for helping people at so many levels. Is this, when you're talking to people about their diet, and maybe they're not as attuned to getting out and doing exercise. Is it critical? Does it all have to be together? Does it have to be diet and exercise to make it work?
Ideally, yes, but sometimes that isn't possible. So sometimes someone will come to see me and they used to be really active, but they've been in a car accident or had some other injury, and they're not quite at a place yet where they can do a lot of physical activity. So always the goal is to be working towards that. But in the meantime, there are certainly other things we can work on, such as nutrition, which is obviously incredibly important. I'm a little bit biased. I'm a holistic nutritionist,
Yeah.
but nutrition, stress management, other lifestyle things that we can incorporate that will still yield results as they're recovering and getting back towards a place where they can be exercising more frequently.
All right, now, Doctor, you have the patients, and Kirsten, you have the clients, right? When you are talking about nutrition, there's a lot of information about there, and sometimes not enough. Is it a complicated thing to eat properly?
That's a complicated question. It can be complicated to find out what the equation is that works for you to yield results. So for us, it's about educating our clients and patients that it's not just about this calories in, calories out equation. The new research shows that it's not just about eating less and moving more. There's a lot more to it than that. So yes, it can be somewhat complicated, and I think that's why I have a job.
Yeah, that's why we're here.
But once we kind of figure out what that equation is, we try and make it as simple as possible to implement.
Okay. And it's not just a matter of losing weight and all your problems are gone either.
Of course not.
Yeah.
Let's talk about the difference between body composition versus weight loss. Who wants to take this one?
Well, we'll both touch on it a little bit, but that's really been one of our big focuses. For a lot of people, we get so fixed on the number and I just want to lose weight. From our perspective, it's really more important to encourage people to shift their body composition. So in a lot of ways, we're trying to encourage people to, lose body fat, build or maintain muscle. And this is just something from a health perspective that is just generally better anyways.
Yeah, I had someone last week, just to give you an example of what that looks like in real life. I had someone last week who she was feeling discouraged because according to her scale, she hadn't lost any weight. But when she came in for our check-in and we measured her body composition, she hadn't lost any weight per se, but she'd actually lost body fat and increased her lean muscle mass in the week. So to me, that's still a very successful week. And no, she hadn't lost any weight, but her body composition was still shifting in the right direction. So that's still progress. So it's not just about how much you weigh, it's how that your body composition is shifting. So to me, if you've lost weight, but that's from your lean muscle mass, that's not a good thing.
Here's the question that I have. Men and women are different I'm told, are different in the way that they carry weight. Is that like guys kind of have it on the inside and women tend to carry it more on the outside? Is that correct? Is that an oversimplification? Or is that even true?
Yeah, I mean, I think it's probably not just between men and women. I think everybody tends to carry weight differently, and some of that is genetic, some of it is hormonal, and I think some people, when they gain weight, they only gain it right around their midsection. I find for a lot of women, they'll tend to gain weight sort of all over. They'll gain it in their hips and their thighs, and a little bit around their back and their arms. So I have seen it different from both men and women, but I do think it's even sort of on an individual basis.
And the other thing is, too, when we're measuring body composition, what we're looking for as an ideal for women is going to be different than that for men. So men generally have a lower body fat percentage than women do. That is still in a healthy range. So for women, it's between 24 and 31%. Is considered to be a healthy body fat percentage, but for men it's between 12 and 21%. So there are individual or gender differences a little bit with regards to what the ideal is.
Okay, 12 and 21.
Jot that down.
I may need to come and have a chat with you. You're listening to Boomer Life on CIL 650, and we're talking today with the good folks from Integrative Naturopathic Medical Center in Vancouver. Naturopathic physician, Dr. Katie Leah, and Kirsten McEwen, a registered holistic nutritionist, the Integrative Naturopathic Medical Center, a long-standing center that offers leading-edge and effective therapies in tune with the needs of today's baby boomers. A reminder, you can get more information at integrative.ca. We'll be right back and talk a little bit more about some of the things that you can do at any age to live and feel better through what these folks are offering here today. This is CIL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.